And I like to use 30 gauge. It just keeps my needle straighter. And when the needle doesn't, because I do a lot of technique like insert, reinsert, insert, reinsert, so, and re-angle, and the needle is too soft, you re-angle it bend, right? Or just even too much manipulation in and out, it will bend. And when it's too soft, when I pull out and re-angle, the needle stays kind of curved and bent. And so my re-angling is not as precise. I want to be able to pull it out and it's already straight, so when I go back in, it's exactly where I want it to be. So that's kind of the challenge with the soft needle. When you're pulling it out, it kind of stays kind of bent still. So when I want to re-angle, I'm still at the same place I was. I'm not able to change the tip to go somewhere else different. Okay? All right, so this position, for the subscapularis, you have a unique patient position. They put the back of their wrist over their forehead. Okay? Now, most patients that have subscapularis problem can't do this, but if I don't want them to have to make an effort to hold their arm up. I want there to be no effort, so I'm going to put some towels or bolsters here so that they can completely just relax the arm without any effort to holding it up. Okay? So if you move your head over a bit more, move your body over to the edge, move a little bit more to that side, a little bit more that side. Yeah, because when, okay. You either do like this, but you want to make sure there's no, it's not behind their head or obstructed. Yeah, that'd be good. Yeah, put this over your forehead. Okay, and then slide it down. Okay, like that. Okay, something like that. And what I'm going to do is I'm going to pull the shoulder blade towards myself, thereby exposing as much of the anterior side of the shoulder blade as possible. I tell the patient, don't help you. So don't lift up to help you, because their body weight helps secure the shoulder blade once it's been displaced. Okay? So I'm gripping the medial border of the shoulder blade. Okay, I'm hooking onto it and just pulling the entire shoulder blade out towards me. And then when I let go, their body weight helps keeps that shoulder blade there instead of going back. Okay. Now, you take a moment to palpate the shoulder blade. You can easily palpate the inferior angle of the shoulder blade and the lateral side of it, and that gives you an idea, sort of the depth that you're going to be working with. For a female patient, ask them to reach over with their free hand, grab their breast, and push it to the other side. So this, put a little higher. No, sorry, that more laterally now. Yes, that one, perfect, that one, okay? Like that. So, because they have a big breast, it will just kind of fall to the side and gets into this armpit area, so it makes it hard to work with, okay? So, those are the basics. And now, what you're gonna do for safety, I've only determined where my lateral edge is. I need to figure out what my medial edge is. And the medial edge is going to be as close to the rib as possible. Now the rib has a curvature, okay? So you should be able to come at this angle and you're going to be butting against the curvature. So I'm kind of like a tangent to the circumference here, okay? I'm at this angle. So I palpate the scapula at the edge, and this is the lats, right? And I start moving in. But don't use the tip of your fingers because that's quite invasive. Use your knuckles, that's a bit more comfortable. And I'm going to butt against, okay? I'm going to use my knuckles to butt against the ribs, like this. Okay? So I'm not actually even near the ribs yet. Okay? I can continue to push even in until there's actually the ribs. So that tells me how wide I have to work with. Can you remove this in for now? Okay? And without poking, okay, I'm going to use the knuckle of my hand. I'm going to push in and find where the edge of the ribs is. So it's actually quite far in. Okay, now you can go ahead and pull your breast away from me. Perfect. Okay. So this is all safe territory. Okay, I'm going in, I'm kind of creeping in, and now my hands are actually butting against the rib. Okay? And we want to be as in as we can, because that's when the subscapularis is most muscular. The more lateral you are, it's very tendinous. Okay? And it's not going to be as effective for releasing muscle fibers. Alright, so once you found your rib border of your rib cage, you're going to just open the fingers, make a little space for yourself, okay, and then put the needle tube in there, and then push that tube that's perpendicular back towards the rib. See how I'm pushing her and I'm moving her body? It's because I'm pushing her ribs. But now with my fingertips, with the blunt of my knuckles, so it's a little bit less uncomfortable. Okay. Okay, so now with that needle as close to the rib cage, basically is a tangent to the rib cage right now. Okay, now I tap the needle in. Okay, and keep my hand there. The most common mistake is that people don't keep their hand there and they don't get really close to the rib cage. As long as you are needling straight perpendicularly downwards, you're going to the back of the shoulder. You're going backward towards the shoulder blade. There's absolutely no danger. Okay, to the ribs, okay, or the lungs. Okay, but notice I'm actually not in the center of the armpit, because if we're in the center of the armpit, there's a pulsation there. Part of the brachial plexus in that area, that's not what we're interested in here. Okay, we're just interested in the subscapularis muscle. So now this perpendicular insertion, and I inform the patient that as I insert slowly, they're going to feel kind of a deep achy feeling. Okay? So perpendicular insertion. And then with my mind intent on the tip of the needle, I'm feeling for resistance when I touch the tip of the scapula. So I'm expecting to touch bone. There, I touched bone. Okay? So this is the 3-inch needle. Okay? I'm not depressing the tissue too much, but in somebody that's bigger, I have to actually not just push in, but push down too, okay, to reduce the thickness. But now I've struck bone, so that means I should have gone through the subscapularis in order to get to that bone. Okay? Now I'm going to do a quick check and to see if I have the right movement for subscapularis. So let me know if anything is too strong or burning, okay? But I'll just do a quick touch first. Okay? That's fine. Okay? Now, we have to assess whether that's the right movement or not. My hand is grabbing the latissimus dorsi right now. So, latissimus dorsi, lats. Okay? So if I feel movement under my hands, then it's the lats I'm getting. The movement of the lats is more of a downwards rowing action. Okay? So this is not the movement we're looking for, so subscapularis, watch. Okay? Okay, I'm feeling. So now I'll show you exactly what it should be. So what it ended up getting here is I'm getting a little bit of serratus anterior, and it's actually doing protraction. This is the muscle that's on the rib cage, so electricity could get into the serratus anterior. So it means that I was a little bit too greedy, and I went a little bit too close to the rib cage. Okay, but this is better than getting the lats. A lot of people have rotator cuff problems or shoulder blade problems. Have that problem, you have to have a problem with the serratus anterior to begin with. Okay, so if I get that, I'm not going to change it. I'm going to take advantage of that and give them a few treatments with that. That's helping to improve the shoulder blade gliding ability over the rib cage. Okay, it's not what I was going for, but I'm going to take it because usually it will help this patient as well. Okay, so let me re-angle, not so close to the ribs this time. Re-angle and reinsert. Still feeling for bone, which is an anterior aspect of the scapula. And then I want to show you what is a proper internal rotation looks like for subscapularis.
Oh well, why not?
Quick check again. Still getting serratus anterior. I'll continue that so you can see what I mean by gliding the scapula. It's no pain, right? Okay, watch. It's moving her scapula out towards me and around. Okay. This is not internal rotation. It can mimic it. Internal rotation will be a different movement, which is more like this. Okay, and we're gonna get it. Okay. Yeah, doesn't twitch. Wasn't sure if that's lats or what it was. Okay. Check again. Any discomfort? No? Okay. Okay, so there's a pretty feeble attempt at internal rotation. Now, every time you're landing on the scapula, okay, and thereby passing through the subscapularis is getting treated. But unless you are in the very muscular part of the subscapularis, there won't be enough of the electricity to contract enough of the muscle to create visible internal rotation. But it's still going to be very helpful. Okay, so this is what an internal rotation looks like. Focus on this part of the hand. It looks like the hand wants to leave the pillow, the arm. Okay, watch.
Bah, je le bras il ouvre, mais.
Like this. Okay. I'm using the ball bearing to hook onto the needle. The reason why I wasn't getting it is because it keeps on jumping away from me. So I now use the ball bearing to hook onto the handle here, okay? And then so the needle doesn't jump away from me. And this is, I know it's internal rotation because it's coming upwards, and at the same time, I'm not feeling a whole lot of activation of the lats under my fingers. If it was the last activation, what's going to happen to her arm is that her arm is going to want to come downwards, as opposed to here, this one here, as opposed to wanting to come upwards, okay, or superiorly. Okay, no, okay. So if you get a good activation, treat it a few times, like I've done, and then I might take that needle out and then reinsert in a different location to cover a different part of the subscapularis.
Oh, well.
So now I'm going to go lower. Okay, I feel the inferior angular scapula. I'm going to go a bit lower, and I butt against the rib cage. Yeah, you can go press that. Okay, thank you. And I butt against the rib cage. Put the needle down. Okay, push it against the rib cage. My hands are, watch, my hands are going in against the rib cage. Okay, tap. Perpendicular again. Start linear insertion. And I'm looking for an end point on the bone. You can feel that on the bone. Okay? And then check it out. My thumb is grabbing the lats. This way I know what it should not be. It shouldn't be lats. And the problem is if you don't get close enough to the shoulder, the rib cage, you're gonna get lats most of the time. Okay, and that's useless for this problem. Okay, quick check. Tolerable? Not too strong. Okay, so I want you to put it on the forehead. Okay. It's actually easier for when we're learning to see the movement. One more time. No. So that the hand should be slightly leaving the forehead. That's the movement we're looking for, okay?
Un peu confortable, tient son bras.
Okay, see how the arm is coming down? That's the lats. Okay, that's the lats, and you feel it under your hands. Okay. So you need to be able to recognize the movement because lats is a common enemy, and that's not what we're interested in. Okay? So I reinserted and touched the scapula again. You won't get a good internal rotation if you're not in